Good morning, John. I'm Sarah, your attendant nurse here today. I'm here to check on your progress following pancreatic surgery. And also, I need to check your vital signs, review the condition of your wound dressing, and inspect the drain tube site. Before beginning it, may I know how you're feeling today?
Good morning, nurse. I'm feeling better now, but I still experience some pain, especially when I move. It only improves after I take my medication. I don't know why it's happening.
John, I completely understand your situation. The pain can be more frustrating for you. However, as you know that you've undergone pancreatic surgery, the level of pain after the surgery is very common and it's part of healing process. Do not be worried. I can reassure you that we will inform your doctor about your condition so that he will recommend the right antibiotics and pain relief medications to help you feel more comfortable. So I would highly recommend you to communicate with your doctor about your pain level or the specific times, including the location and intensity, so he can plan your treatment more effectively. Okay, John, I hope you're following me.
Definitely, nurse. But what about those tubes? They are really uncomfortable for me, and the tube seems to get in my way every time I try to move. I don't know what to do.
I can sense your worries, John. I understand that having this tube in place can feel more uncomfortable and restrictive, especially when you're trying to move. Let me explain to you why the tube is necessary and how it helps your body in the healing process. May I proceed?
Yes, nurse. You may please.
This drain tube helps remove any excess fluids that could accumulate around the surgical site. By cleaning out that liquid, the tube helps prevent infection and keeps the area clean, which will help your body to heal more effectively. Moreover, it is completely normal to have a drain following surgery like this. But don't worry, it is just a temporary part of your recovery. We will monitor your progress and the tube will be removed as your condition progresses. Okay, John, I hope it's clear to you.
Okay, nurse. It makes sense. But why is the wound dressing changed so frequently? It feels more uncomfortable every time it's done.
I understand your feelings, John. It can be really uncomfortable to have the dressing changed frequently. We change the dressing regularly to keep the area clean and to monitor for any signs of infection, such as swelling or redness. Changing the dressings regularly helps keep your wound protected and reduces the risk of any complications. Okay, John, I hope you understand the importance of changing the dressing regularly.
Sure, nurse. I understand that.
Glad to know that, John. Please let me know if you have any more questions.
Nurse, are there any specific signs or symptoms I should watch for?
John, I truly appreciate your concerns. Yes, there are just a few signs to watch for that will help us to confirm that everything is healing as expected. Let me walk you through this in detail. If you notice any increase in drainage, fluid from the drain, an unusual odor, or redness and swelling around the wound, please alert the nursing staff immediately so that we can provide the appropriate treatment accordingly. Okay, John, do you have any more questions for me?
No, nurse. Thank you so much for your support.
Happy to know that, John. Can I have your consent to begin the clinical observation now?
Sure, nurse. Please go ahead.
Thank you, John. Before beginning the clinical observation, let me recap our discussion. So far, we have discussed your condition following pancreatic surgery, importance of keeping the drain tube, and the wound dressing. I hope you understand that. Now, I'm going to begin the clinical observation. In between, if you have any more questions, do not hesitate to ask me. We are here to make you more safe and comfortable. Thank you, John, for your time. I wish you a faster recovery. Thank you all.